Alright, we're going. The gluteus maximus. The origin is the iliac crest, posterior gluteal line, and lateral surface of the ilium, sacrum, coccyx, and thoracolumbar fascia. The insertion point is the iliotibial tract and gluteal tuberosity of the femur. The action is extension and lateral rotation at hips. It helps to stabilize the extended knee, abduction at the hip, and superior fibers only. It's innervated by inferior gluteal nerve L5 through S2. The gluteal medius, the origin is the anterior iliac crest, the lateral surface of the ilium between the posterior and anterior gluteal lines. The insertion point is the greater trochanter of the femur. The action is abduction and medial rotation of the hip. The innervation is the superior gluteal nerve L4 through S1. The tensor fasciae latae. The origin is the iliac crest and lateral surface of the anterior superior iliac spine. The insertion point is the iliotibial tract. The action is abduction and medial rotation at the hip, extension and lateral rotation at knee, tensor fasciae latae, which laterally supports the knee. Innervated by L4 through S1. The piriformis. The origin is the anterior lateral surface of the sacrum. The insertion point is the greater trochanter of the femur. The action is lateral rotation, abduction of hip, help to maintain, stabilize, and the integrity of the hip. The innervation is branches of sacral nerves S1 through S2. The abductor longus. The origin is the inferior ramus of the pubis, anterior to the adductor brevis. The insertion is the linea aspera of the femur. The action is adduction, flexion, and medial rotation at the hip, innervated by the obturator nerve L3 through L4. The adductor magnus. The origin is the inferior ramus of the pubis, posterior to the adductor brevis and ischial tuberosity. The insertion point is the linea aspera and adductor of the tubercle of the femur. The action is the whole muscle produces adduction at the hip, anterior part produces flexion and medial rotation, posterior part produces extension. The innervation is the obturator and sciatic nerves. The gracilis. The origin is the inferior ramus of the pubis. The insertion point is the medial surface of tibia inferior to the medial condyle. The action is flexion and medial rotation at the knee, adduction and medial rotation at the hip, innervated by the obturator nerve L3 through L4. The iliacus. The origin point is the iliac fossa. Insertion point in the femur distal to the lesser trochanter, tendon fused with that of the psoas major. The action is flexion at the hip and or lumbar intervertebral joints, innervation by the femoral nerve L2 through L3. The psoas major. The origin is the anterior surface of the transverse process of vertebrae T12 through L5. The insertion point is the lesser trochanter in company with the iliacus. The action is flexion at hip and or lumbar intervertebral joints. Innervation, the branches of the lumbar plexus L2 through L3.